Our video is about the newborn assessment normals education. We believe that this is an important topic for a new mother to understand because she should know what is normal and abnormal about her newborn, especially when to call the provider. A newborn assessment is broad in regard to a nurse because there are many factors to consider when assessing a newborn. However, we highlighted APGAR score, vital signs, measurements, general abnormalities, and reflexes in our newborn assessment normals education video. Stated by the National Library of Medicine, today over 98% of the 4 million newborns born annually in the United States are tested for more than 30 treatable genetic, metabolic, endocrine, and infectious diseases within the first week of life. This is why it is so important to let the medical staff assess the baby as soon as possible so they can take quick measures to treat it or prevent it from getting worse. So our video today is about the newborn assessment normals, and these are all good indicators on whether or not your baby is at the right stage of growth. So our first objective is the mother recognizes abnormal findings of their newborn and when to call the physician by the time of discharge, and then the mother can assess the newborn independently by using the teach-back method by the time of discharge.
Hi, congratulations on your new baby. I'm gonna take him away to do a quick assessment, okay? But I'm gonna do it right here so you can see.
Okay, so this is the APGAR test. We do it at 1 and 5 minutes post-birth, and A stands for appearance. You don't want to see any blue on the extremities at all. And then P is for pulse. You want it to be over 100 beats per minute. G is for grimace, and A is for activity. You want to see the arms and legs flexed usually, and then R is for respirations, and you want to see them strong and crying, and then you also don't want to see nasal flaring or any like accessory muscles moving as well, and the total APGAR score should add up to 10.
Okay, so your baby, let's just start off by the appearance of it. He looks like a nice healthy boy. He's pink, but then he has blue on his fingers and feet. That's okay within the first day. That's normal, a normal finding. But after that, by the time of discharge, we want that to be pink along with the rest of his body. And then the second one is pulse. I just checked his pulse. It was 140, which is good. We want that above 100 or 110. 100 if the baby is sleeping, but 110 if the baby is alert and oriented. And your baby, also we want to look at the grimace. So when I originally picked your baby up, your baby started crying, which is what we want to see. We want to see that engagement, and your baby is engaged with me right now. And then next, activity. Your baby can move all of its extremities, and if you see the baby is in a more flexed position, just like it was in the womb. So that gives an active score. For respirations, your baby is not grunting upon breaths, and the nose is not flaring. You can see the little chest wall go up, but the baby isn't using all the accessory muscles for it. So now I'm gonna have you feel what a normal respiration should feel like. They should be between 30 and 60 beats. So every time the baby's chest goes up, that's 1, and you wanna count for a full minute. If it's between 30 and 60, that's in normal limits.
Okay, so now we're gonna look at your baby's head. They have 2 fontanelles, so they have this one on the anterior, you can feel it. You feel it's soft. And then they have one on the back, which is the posterior. That's normal, that's gonna allow for their brain to grow. And the head is about 1/3 the entire body size, so it's pretty big, but that's good because a big head size means that the baby's head is growing well and it's developing strong. And so now we're just gonna check for symmetry. And so the outer canthus of the eye should match up with the ear, and so it does, that's normal. And it's nasal dependent breathing, so your baby's not gonna breathe with their mouth until 3 months of age, because this breathing with their nose and not breathing with their mouth allows them to suck the milk and breathe. Okay, so now we're gonna look at some of your baby's reflexes. So the first one we're gonna look at is the rooting. So as you tap the side of the cheek, the head is gonna turn the way towards that your finger is. And that's kind of like what is similar to like if your nipple kind of strokes the side of their cheek, they're gonna ultimately go and look for it. And then the second is gonna be the sucking. So if you wanna stick your finger in his mouth, you see how he automatically starts sucking? Yeah. That's good, you want the baby to start sucking. Okay, so now we're gonna look at the Moro reflex, which is the startle. So when you lift your baby's arms up and slightly drop them, they're gonna, come together because you startle them. That's a good sign. That means that their nervous system is working correctly. Next, if you just put your finger in, this is the palmar grasp, grabs your finger. Yep, and then the same thing with the toes. If you go right under the toes, it's your grab if you want to put your finger under. Perfect. And then also another thing is if you go from the outer side of the foot and you kind of with your hand and you move it under the toes, it's going to sprawl. That's the Babinski reflex. That's also normal.
Okay, I just measured the height and weight of your baby. And the weight, you have a beautiful 7 pound, 8 ounce little boy. And then we measured also in centimeters from the feet to the head. We also want to check vital signs. And when checking vital signs, we want to focus on the 3 vital signs, which are the pulse, the respirations, and then the temperature. We always want to do the least invasive to most invasive when we do these. So I'm going to do these now.
Is that just so you don't wake up the baby and it's easier to get?
Yes, because it can throw off the heart rate if the baby is crying, but right now the baby is relaxed, and sometimes the babies just don't like these in their armpits because we want to make sure we do it in their armpit and not their mouth.
So, Mom, you're not expected to know all the normals of the vitals, but here are some important things to know. So, heart rate, the normal range is 110 to 160 beats per minute. Lower heart rate can be signs of like if they're pale or like weak, and then higher heart rate is when they're like more active, can be like crying. If they're sweating, that could be like even above 160. So the normal temperature range is 97.8 to 99.5 degrees Fahrenheit, and you can just check the nose, the cheeks, and then the back of the neck kind of to get a feel for what their internal temperature is. And babies are more prone to infection, so this is a good way to tell if they do have infection. And then respirations, the normal range is 30 to 60 respirations a minute, and your baby might be a little bit higher because transient tachypnea is normal after birth.
We also do want to let our patients know, and this is supported by the American Academy of Pediatrics, that the baby can lose up to 10% of their body weight in the first week of birth, but then that next 10 days we want them to gain it back. And then after that, they're expected to gain about an ounce a day. I know this is super overwhelming as a first-time mother, and I want to reduce that in any way possible. So are there any questions you have for me?
Yeah, just when should I call my physician?
Okay, yeah, so going over all the assessments, I know we went over a lot, but just going through the steps, like if your baby is crying too much and your baby's hot and your baby is sweating, that can be a sign of infection, and that's when you want to call your doctor. You also, like back to the respirations, like I was saying, if those nostrils are flaring, and like we were saying that the baby is respiratory driven, so if the nostrils are flaring or you hear that grunting with every breath, that's when you also want to call your physician. Or any time that you think something with your baby is wrong, we ultimately trust you, and we want to make sure that you trust us with the care and support of your baby. So we do want you to call the physician.
Okay, Sarah, it's time for discharge. Do you have any last minute questions?
I think I feel pretty confident. You guys did a really good job explaining everything to me. I feel really confident about when to call my provider if my baby's experiencing fever or his temperature is low. I also know like when to check respiratory effort if anything's abnormal there, his vital signs and everything like that. I also know like the skin abnormalities, how to check that, rashes and anything abnormal. And then I also feel pretty confident if to check like disengagement if my baby is not acting right, like if his limbs are extended, and if just anything's abnormal in general. So I feel pretty confident.
Great.